Professor, tell us a little bit about the study that you were involved in that was reported here at AAO 2015.
I'm very excited to share the Newton study. And what the Newton study was looking at was patients who had central retinal vein occlusions and had macular edema. Central retinal vein occlusions can be devastating, and the recent advent of anti-VEGF therapy has really revolutionized our care for these patients. However, many of these patients need chronic therapy. When we've done some follow-up studies from the original landmark phase 3 studies, we've seen that over 55% of central retinal vein occlusion patients require repeated injections, and this can be very challenging in the clinic.
What are we talking about in terms of frequency of injections?
So for many of these patients, they need regular injections every 6, 7, 8 weeks. And if they don't receive their injections, their macular edema rebounds and their vision drops. So they often need these treatments. They do well with the treatments, but it's a very chronic type of situation. And when I say chronic, this has been going on for years. So the purpose of the Newton study was to look at patients who are being treated for macular edema due to a vein occlusion. If they were set at a certain interval, was it possible to increase that interval with one of our newer treatments, Alflibercept or Eylea? And the clinical question really was to see whether you could increase that treatment interval to decrease the dosing and decrease the treatment burden. We recruited 20 patients into the study. These were 20 patients who had been chronically treated for macular edema due to a vein occlusion. They averaged about 15 treatments before and averaged a treatment every 5 to 6 weeks. They were then transitioned to Alflibercept and then treated on a treat and extend type of protocol to see if you could increase that interval.
What were the results?
So the take-home results, if there's one thing to walk away from this interview, was that with the transition to Alflibercept, the interval increased by 28 days. And it was quite remarkable. 16 out of 17 patients who made the 52-week mark all had improvement. So it was very consistent and very dramatic. And so the question is what does 28 days mean? And you may think that doesn't sound like very much. But in a year, if you're getting a treatment every 5 to 6 weeks, that equates to 10 injections and 10 visits. By transitioning to Alflibercept, you can decrease that burden to 6 visits and injections over a year, which over years becomes a very big deal and really minimizes the treatment burden for this special population.
Were there any particular complications that you noted?
So complications-wise, it was a very safe study. There was one unrelated complication where one patient developed a macular hole and retinal detachment 8 weeks after a treatment, and we felt it was unrelated. But otherwise, the treatment was very safe. The results, there was improvement in vision, about 7 letters, and a decrease in retinal thickening.
What are your next steps for this line of research? Are you going to do a larger trial with more patients? And is this going to be multicentric or continue in your center?
I think one of the things we want to do is learn more about our patients with central retinal vein occlusions. It's nice that we've been able to increase the interval by 4 weeks, but it's still a chronic disease. And so one of the things that we're doing is we're extending the study for another year, and we're going to see if we can rechange that interval at a later time. There's some very exciting studies being put on right currently, the SCORE-2 study, which is going to look at different treatments for central vein occlusion. So we're hopeful with these new studies that are coming forward, we'll learn more about the disease to give our patients more treatment options.
And you'll be continuing to follow the existing patients longitudinally over time?
Correct. We're going to be extending the study from 1 year to 2 years to see how they do over time.
Excellent. Well, I think it's fascinating, a terrific study, and great and promising results. Is there anything else you'd like to add about other programs or projects that you have underway?
Well, I think it's a very exciting time for macular diseases, from central retinal vein occlusions to diabetic macular edema to macular degeneration. Our treatments have really been revolutionized with anti-VEGF therapy, which is wonderful, but we want to try to do things in the future to minimize the treatment burden while achieving these good results. So I'm very excited with future drug delivery options that are out there, with new treatments, combination treatments. So it's a very exciting time for our field, and we look forward to bringing these results more to the clinic.
Professor Khurana, thank you so much for joining us.
It's my pleasure.